My name's Charlotte Wiseman, and I'm the founder and CEO of Charlotte Wiseman Leadership and Wellbeing Consultancy. We're an organization who helps businesses to embed positive psychology principles into the workplace. We do that through leadership development, through all-team mental fitness, and through mental health first aid. And I'm here today, very pleased to be partnering with the Marketing Academy for this pre-recorded session all about mental fitness. Today is going to give you tools about understanding how you can manage and look after your own mental fitness. It's also going to give you some techniques and ways that you can support others to look after themselves and enhance their mental fitness. So it's going to give you a range of skills, and I'll talk you through those in a minute. Before we get into that, I do just want to give you a little bit of a background as to what's brought me to this position and why this might also be important for you. So I didn't really understand the concept of mental health. I didn't actually think that it was something I ever really had to think about until about 12 years ago. So until that point, I had definitely had empathy for people who experienced mental illness. I didn't really know what mental illness was, and I didn't really think it was something that applied to me. At that time, I was working in design. I was working in the fashion industry, and I was a designer, enjoying my job, seemed to have a pretty good life. And I very suddenly went through a quick series of promotions and found myself quite quickly running and managing an international design team. I was being paid to travel the world and spend most of my time in Bali. So it didn't look like a terrible job. And when you've grown up saying you want to be something and then suddenly you make it, it's a pretty exciting moment. So I threw myself into my job. I absolutely wanted to give it 120%, and I did that. I was working with factories all over the world, so I pushed and made sure I was always available to them so they could do their best work. And that meant they were open on the weekend, I was open on the weekend. I was always able to in evenings or in early mornings, get online and speak to someone, support someone. And I took pride in the fact that I was working hard and things seemed to be going well. The business was booming, sales were going up, reputation was growing, and I seemed to be getting the recognition from the business. And I thought that was fine. I didn't really associate some of the things that were showing, I'm going to say some of the cracks that were showing, with anything other than just normal things. I had a bit of stomach problems and things that I felt like I must be intolerant to different foods, so I was cutting them out. And I had a back problem, but I thought, oh, I must have hurt it while I was running. And I was becoming a little bit snappy with people, but I thought that maybe people weren't realizing the urgency of what was going on and how important things were. I was becoming a bit forgetful, but I thought that maybe I just had so much on and that was what was going on. And all these cracks I can see in hindsight, but they certainly didn't seem present in that moment. I just thought things were going well and everything was fine. And that all changed for me when I was out in Indonesia and I was walking out of the factory at the end of what I would suggest is a normal, stressful day. I'm not saying it was a stress-free job, but I thought the stress was normal and fine. And I was walking out of the factory and I walked out into the road where we used to wait for the taxi. And I was just very suddenly hit by a feeling of overwhelm, of I can't live another day like this. I can't do this. I don't want to do this. And it came very suddenly. And I remember standing in the road and looking up at this sign and just looking at it and desperately wanting to cry and not even feeling like I had the energy left in me to cry. There was this absolute depletion, this numbness. And as I stood there and I looked up, I remember knowing something had to change, but not being able to really think or understand what that was. It was just like, I can't do this and there's no other way. And I can't do this. And two people walked out of the factory and tried to talk to me. And as I tried to speak to them, the words wouldn't come out. I was speaking, but the words weren't coming out. And it was a very odd experience and a kind of a dreamlike state when I look back to it. Anyway, in all their wisdom, these two people who were visiting from the UK adopted the wonderfully British approach of let's go for a drink, you'll be fine. And they took me off for a drink. And I went with them and I sat and I stared at a drink, sitting by the side of a road, staring at a drink, unable to cry, unable to think, unable to speak, and unable to really understand what I needed to do. Anyway, later that night, I was able to get back to where I was staying, and I managed to talk to my doctor back in the UK. I was very lucky that there was a callback service with my GP. And she was very quick to say, Charlotte, you have to quit your job, you have to come home, and you have to take time out. And I was very quick to say no. And that was a decision which surprises most people, and a decision which I can't really say why I made it, but I assume I made it probably because I didn't want to let people down. And while that wasn't the right reason to make that decision at that time, it certainly was the best decision for me in the long run. And I think that if I had taken away my work, if I'd stopped my work at that time, I don't know if I would have had a reason to keep going. I don't know if I would have had a reason to get out of bed. And I think that's a really, really important point, because we so often assume that if someone is struggling with their mental health, they should take time off, they should stop work, they should step back. And while that is absolutely the right decision for some people, it's not the right decision for everyone. And very often what happens is people move away from their work, they take time out, they feel better, they come back, but they haven't made any changes to their behaviors or their habits. And so very quickly they get back right to where they started. And by choosing to work through my recovery as I did, I was forced to make changes. And I started to make those changes very, very quickly. I was able to start with online therapy a few days later. I started to integrate a 10-minute lunch break into my day, just 10 minutes offline. It was quite a revolutionary concept for me at that time. I started to integrate 5 minutes of meditation in the morning and 5 minutes in the evening. And I started to just make these what I call micro changes. And that was over time what's enabled me to then sustain my health since then. Now, for me, that was also really important, because I think it can be so easy to demonize that work is the source of stress. And if we step back, everything's okay. And work isn't always the source of stress. It can be a component within our lives, but it's not the work that's the problem. It's the way we interact and the way we manage the work. And actually, if we can learn to manage our mindset and manage our behaviors and manage our habits, then actually work becomes a very positive part of our lives. And it is actually something that enhances and improves our mental health, not inhibits it. And that's a huge part of my work now, is helping people to create the environments where people can thrive, where people can lean into stress and actually make stress a positive aspect of their lives and make work a positive part of their lives. So the workplace is somewhere that we want to be rather than just somewhere we have to go. So this, for me, this moment was the start of my research and my interest in psychology, and specifically workplace psychology. And it started at that point as just a hobby. I was reading a lot about resilience. I was reading a lot about psychology and positive psychology. I started to do an online degree in psychology, and it grew and it grew and it grew until eventually 6 years ago, I quit my job, went back and did a master's in applied positive psychology and coaching psychology, and specialized in the area of leadership well-being and leadership burnout. And I've taken all that knowledge now, and that's what I take to businesses. And so I do have a sort of an evidence-based research and science background, and today will all be built on that. I am also a mental health first aid trainer, so I will be bringing some of that in. But more than anything, today is going to be about a practical session. It's going to be a practical session, and I'm going to make it as interactive as we can in a recorded setting. So I will, as we go through, be introducing you to some tools, some techniques, and I'll be encouraging you to pause sometimes and reflect on those questions I ask you. The key is that mental health is something that affects us all because we have it all. All of us have it every single day. And it's sometimes a little bit higher and it's sometimes a little bit lower. But we're going to explore that in today's session. We're going to demystify really what mental health means. What's it all about? I'm going to introduce you to this concept of mental fitness and what that's all about. And I'm going to give you some tools and some techniques and some ways that you can boost your mental fitness. And I'm also going to give you some ways that you can start to be more confident in the conversations that you have with people about mental health and mental fitness, supporting those who might be struggling and actually encouraging and inspiring those who aren't struggling but want to do even better. So let's get started, and I'm going to do that by sharing some slides with you. So I've already mentioned that we're going to go through 3 areas today. We're going to start by demystifying mental health. We're going to look at how you can enhance yours, and then we're going to look at how you can support others. And the skills you get today are applicable in the workplace, but they're also going to be applicable out of the workplace, with your friends, with your families. You might find some of the conversation techniques are applicable in conversations that aren't even about mental health. So you're going to get a huge amount. And I would suggest that you will probably also just start to see the world a little bit differently as the result of today. So mental health as a concept is very often misunderstood, because when people talk about mental health, we often assume people are talking about mental ill health. So when you go into a business or you talk to someone and you say, oh, I want to talk about mental health, people very often assume that mental health is depression, anxiety, illness, maybe stress. But mental health is exactly the opposite. Mental health is when we're healthy. So the same way with our physical health, it's about when we're physically healthy. But there are times, of course, when there'll be nuances and adaptations, and maybe we need to think about mental health less of a state and more as of a continuum or a spectrum. And that's what I'm going to introduce you to today. So the concept of health, as defined by the World Health Organization, is that it's a state of physical, mental, and social well-being. So those 3 things interrelate. Your physical health will impact your mental and your social health. If you think about a time when you've slept well, you might be mentally more alert, a little bit more patient, a bit more fun, a little bit calmer, a bit more clear in your communication. When you're feeling sick, you might have a little bit of a lower mood. You might be a little bit less likely to want to go out. So it starts to impact those other 2. And the same goes for the other way around. So your mental health impacts your physical health, your cardiovascular function, your immune function, your digestion and reproduction. Your mental health impacts your social well-being, your relationships. And your social well-being impacts both your mental and your physical health. So much so that there's actually research to indicate that being isolated can be as bad for you as smoking 15 cigarettes a day. So it really does have a big impact. And when we talk about health, as I've mentioned, it's not just about, oh, well, we're not sick, therefore we're healthy. There's these kind of nuances to it. You know, we can feel maybe physically healthy, but we might have a sprained ankle. So there's this kind of nuance there. We might feel physically healthy, but we've not had a good sleep. So maybe that has an impact. Might be physically healthy, but we haven't been to the gym in 4 years or haven't done any exercise in 4 years. So there's nuances, and we're not just talking about a binary state of health and ill health. And that's the same for mental health. So if we zoom in and we look at what mental health is all about, mental health is what is affecting everything that we think, feel, and do. So it's our brain state. And that affects, of course, how we think, but it affects our emotions and the physical sensations we feel. So when we're less mentally healthy, we're more susceptible to pain because the body is on high alert. It affects how we behave, the decisions we make. It affects how we interact. It also affects how we see things. So it affects how we see our lives and interpret situations, including the present, but also how we remember memories and how we imagine the future. It affects how we see people and how we think people see us and how we see ourselves. And it affects how we deal with the normal ups and downs of life. And that's really crucial. So it affects our resilience. It affects whether that train delay or cancelled flight really affects us and we can't deal with this and we think it's overwhelming, or whether we go, oh, well, that's okay. And that's very often a sign that if we're starting to have a bit of a decline in mental health, what happens is we start to find that small things feel a bit bigger. And that's exactly what's going on. So when we think of what mental health is, it's defined as a state of well-being in which we realize our own potential. So it's a positive state. It's a state when we're at our best. And that's really very important. It means that we can cope with the normal stresses of life, we can work well, and we can be a positive influence on the community and the people around us. The way that we can really understand this is by looking at this continuum that I've mentioned. Until 2002, we only knew about this x-axis. And that assumption was that some people have an illness, a mental illness, and some people don't. And that's it. That was really all we knew. And we assumed at that point that if you had an illness, you'd probably struggle, probably find it hard to keep a job, not really going to be enjoying life, and probably should lower your expectations of life. And that really was the view, certainly until the late 1990s. Maybe by the 1900s or the 1990s, we were starting to understand that there was some variation there, but it was still quite binary in that thinking. The assumption was on the other end that if you didn't have a diagnosis, then you're fine. Keep calm and carry on. But in 2002, a research study by someone called Corey Keyes identified this second axis of what we call mental fitness. And this is more about what we've just been talking about, that ability to manage ups and downs of life, to motivate ourselves, to be patient, to understand other people's perspectives. All of those things that are about thinking and feeling and being at our best, that is actually this y-axis. That's this mental fitness. So while someone might have a mental illness and really struggle with day-to-day life and find it very hard even to get out of bed, once that person has the right support and treatment, they might still have a diagnosis of an illness, but they can have very good mental fitness. So very good mental health with that illness while still having that diagnosis. On the flip side, someone might have never had an illness and have never had any challenges with their mental health or fitness. But any changes that they experience can mean they have a decline in that mental fitness. And those changes could be things that are perceived as positive, things like a new job or a house move or becoming a parent. It could be something that's perceived as negative, like a job loss or bereavement. It could simply be that someone stops looking after themselves, starts drinking too much, not looking after their physical health, not switching off from work. But anything can cause them to have that decline in their mental fitness. That doesn't mean that they've got a mental illness, but it does mean that they're not going to be enjoying life very much. They're not going to be thinking and feeling and performing at their best. They're not going to be particularly engaged or satisfied by their work or their lives. And what we know is that when someone is in that bottom quadrant, they're 6 times more likely to develop an illness. But furthermore, sometimes people remain in that quadrant for a long time, and they're actually less engaged with life than someone with a diagnosis. They're less likely to do anything about it, to take action, to reach out. They're what I call sleepwalking through life, and they don't care. And that's such a sad state, to not be living life, but to just be surviving life. And what we see in the post-pandemic world is that we feel the indicators of research show that there's more people in that bottom quadrant than ever before. And there are more people getting a diagnosis because people are down in that bottom half and not taking action. And so today, what we're doing is we're looking at, okay, well, how do you be more aware so you can stay on the top side of that axis, the top side of that y-axis? How can you keep your mental fitness high? And also, how can you encourage and support those around you to do the same? And what we see is that once one person starts to take action, the ripple continues. And if we could help everybody to just be 2 or 3% mentally fitter, we would have a bigger global impact than if we eradicated all mental illness. So that's a fantastic invitation. And that's my invitation to you today. Some of the things that help us to be on the top side are mental, some of them are physical, and some of them are social. So this is where we start to see that interrelationship between those three elements. These are what we call protective factors. They're the things that help us to be at our best. The physical ones, perhaps obvious, sleeping, getting exercise, not using too much technology, but also very basic ones like just having a physical, safe environment. Some of the mental ones, again, you might know, and some might be a little bit more distant for you. So knowing our strengths and values, having goals. Emotional literacy is about actually acknowledging and knowing how we feel, which is a lot more difficult for most people than we realize. Social aspects, it's actually about having feedback is a really important thing, both negative, constructive, positive, all of that. It's about being within a community where we feel supported and safe, and also where there's diversity. Really, really important for our mental health. On the flip side, the things that might put us at risk, they can be sometimes just the opposite of those protective factors, but there might also be other elements, very unique elements like childbirth, bereavement, could be an experience of trauma as a child or trauma in the recent history. Could be the unemployment, could be a social situation, discrimination. But there are a number of these, and they all start to work together to either move us up or move us down. But one final reminder that you will not see anywhere on there anything about work, because work is actually something that promotes mental health if you have the right conditions. So we can use our workplaces to create those protective factors to help people to be mentally and physically fitter and healthier. And that's a really, really important message for me to send to you. So let's start to think about how we can do some of this. How can we take action to improve our own mental fitness and support others? Well, another way we can think of that continuum is that when we're higher on that y-axis, we have a big mental fitness container or resilience container, which means that as stress comes in, challenge, pressure, change, all of those things which naturally causes stress, we can hold it because our container is big enough. The thing is that all of us, I would suggest, at some point have overflowed. We've had more stuff coming into our container than we can deal with. And we show what I call the stress signature. We all have a unique stress signature. You might know your own. I know mine. I get stomach problems. I get back pain. I start to have funny dreams, and I miss people's jokes. So I know those things. And there are a number of other things. I won't go into the long list, but it's good to know your stress signature. Because your stress signature isn't a bad thing. What your stress signature is your body's alarm system going, please change something. Please do something for me. It's not a bad thing. Stress isn't bad. Stress signature isn't bad. All of it is just a situation. And if we can take that stress signature as data to act on, then we can use our tap and we can release some of that stress. And we can try to adopt healthy strategies to do so. Now, all of us will have both healthy and unhealthy strategies, or helpful and unhelpful, let's say. Helpful strategies being maybe taking a break, getting a good night's sleep, going for a walk, speaking to someone, delegating something, saying no. Unhelpful strategies might be ignoring it, not telling anyone, trying to cover up for the fact that you've missed something, drinking too much because you just want to forget the day, not getting into bed until 2 in the morning because you're trying to finish stuff, and then the next day you're going to be tired. All sorts of things that we find. And very often we are accustomed to going to the unhelpful ones, even though we know what the helpful ones are. But that's why this activity is going to help you to articulate and understand those, so you're more inclined and more aware and more able to access those helpful strategies. So I'm going to invite you to start by identifying your stress signature. And with your stress signature, these are some ideas. This is not an exhaustive list, but I'm going to encourage you to find at least 3 and to pop it into the top right-hand side of your handout, which should be available to download with this video. So top right side, where it says stress signature, I'm going to invite you to pause for a moment and write down at least 3, and if you've got more, maybe up to 5, 6, or 7 signs. And when you're ready to carry on, we'll move on to fill out the next box. The next box I'm going to invite you to fill in is this top one, the protective factors. So your protective factors are the things that you know you should be doing all the time to keep you at your best. They're those protective factors, not necessarily the things you do in a moment of stress, but more the maintenance activities that you know are useful for you, like getting enough sleep, doing some exercise, having hobbies to look forward to, eating well. And again, I'll pop some ideas on there so that those can prompt some thinking. And I'm going to encourage you again to try to come up with 3, and again, optimally 5 different things that you know are good for you, mentally and physically, all of those areas that just help you to feel, think, perform at your best. I think of these as the 5 a day for the mind. Pause the video if you need to, and I'll give you some time to fill that out. And when you're ready, we'll move on to the next box, which is the one in the middle. What is coming in to your container? So for this, you can put in anything, however big or small. And that's really, really important. That sometimes, if we've got lots of little stuff going on in our lives, it takes up space in that container and we don't give it the validity that it deserves. We go, oh, but I haven't got anything to stress about. But if you've got a million different little things, it takes up space. It's like pebbles or grains of sand. So into your container, I'm going to invite you to write down anything that's taking up brain space, anything that's taking up mind time. And the reason I've got the T with a circle around it is that sometimes if you're doing this in a group, sometimes if you're doing this close to other people, or if you're doing this by hand and you think someone might find your piece of paper, you don't want to write down everything. So if there's anything you want to keep personal, you can keep your own little symbol, your own way of remembering it without using the exact word. And that might be useful because you could choose to do this activity with your team or with other people, and that might be something that becomes useful in the future. I want you to spend some time to fill this out with all the big stuff and the small stuff, and encourage you to pause it again. And really, once you think you've got everything in there, just give yourself a little bit more time to really think about what else. And then when we're ready, we'll move on to helpful and unhelpful strategies. And that's where you start to fill in these bottom two boxes. And again, I want you to be really self-inquisitive. I want you to think about, okay, when are different things helpful and when are they unhelpful? Because sometimes things might be helpful at some moments, unhelpful at other moments, or helpful in a short term, unhelpful in a long term. So for example, working hard and doing a late night, there's nothing wrong with that. But working late nights and working 50, 55, 60 hours a week, week on week on week, that might not be helpful anymore. Helping other people, really important. But if you're never giving yourself the time to do what you do and you need to do, that might be detrimental to you in the long time. So it's about being really aware of when things are helpful and when they're not. Another example for me is that when I'm rather overwhelmed, I'll make lists. And sometimes that's useful because then I know what I need to do. But when I'm really stressed, I make lists of lists of lists and I don't do the things on my lists. And it's my number one procrastination technique. If you see me rewriting a list, feel free to stop me because it's a sign that I'm procrastinating. So take some time. And again, I'm going to encourage you to find at least 3 on each side. And that might be quite challenging. So you might need to pause it, take some time, think a little bit more deeply. It might be that there are some things that you know would be helpful, but you never do. That's okay. You can put them on your helpful strategy. You might notice that there's some crossover between the protective factors and the helpful strategies. And that's absolutely normal. It's just that the protective factors are more the ongoing maintenance activities, and the helpful strategies are more of what you maybe do when you feel the overflow. You might also see a crossover between the unhelpful and the stress signature. And that's, again, very, very common and absolutely fine. They both work. So take some time to think about it. Take some time to think about your helpful and your unhelpful habits and where they cross over. And as you do this, I want you to know that there's no right or wrong. There's no definition of what's okay. There's no definition of what's stressful and what's not. There's some wonderful research by someone called Jackie and Aaron Schiff, and they talk about this idea of the window to the world. And that is that we all have our own unique view of the world, based on our background, goals, history, gender, age, values, the role models we had as children. All of these things, everything that we've experienced since even before we were born, impact the way the brain interprets and sees the world, and therefore what's stressful, what's not, what's exciting, what's not, what's helpful, what's not. So don't think that you're trying to get this right. Think of this about understanding your window to the world a little bit better. So pause the video, take some time to fill out your container, and then when you're ready, we can carry on to the final part of this session. So we're coming to the final piece of the puzzle, which is how we can support others. This is so important. When I talk to people in businesses, the number of people who have found that someone in their company has left, and in hindsight, they say, I knew they were struggling and I never started that conversation. It's so, so common. And there's the same reasons that people don't reach out. People don't reach out to support others, number one, because they think, I don't know what to say. What am I supposed to say? And actually, you don't really need to say very much. You just need to start a conversation. Just need to show that you care and you've seen the person, you've noticed them. And I'm going to give you some tips on that in a moment. The second thing is that people, and specifically managers, say, yeah, but I can't fix it. I can't change it. So I don't want to have that conversation. There's no point. But again, to support someone and help someone, you don't need to change their situation. You just need to be there, notice, and show you care. Normalize how they feel. Let them know it's okay and that we all have fluctuations in our mental health. And the third reason is that people worry they're going to pry. Well, they don't want to talk to me. I don't know them. Or it's not going to be comfortable. Well, I tell you, it possibly won't be comfortable, but it doesn't mean you're prying, and it doesn't mean they don't want to talk to you. More often than not, if someone is struggling in any way, they do want to speak to someone, but they don't want to interfere. They don't want to interrupt. They don't want to be a burden. And they don't know how to start the conversation either. So by you starting that conversation, you're doing a huge amount. You're helping them. You're giving them that opportunity without them having to take that step. And if they don't want to talk, they don't have to talk. You don't have to push or pry. You just have to give them an opportunity. So this is really important when we know how many people experience poor mental health every year. The recent data shows that 1 in 4 people will experience poor mental health to the stage of a diagnosis in any 1 year. So that's 25% will experience a diagnosis, or would experience a diagnosis if they went to get help. And that's an important fact. Not everyone is going to get help, but that is the evidence that 25% of people would meet the diagnostic criteria if they reached out. But a further 16% have experiences and symptoms of low mental fitness, but haven't got to that diagnostic stage yet. So those are the people on the bottom right side of that quadrant who are showing the signs and are then at high risk of developing an illness. Now, this data was gathered before 2020, and therefore it is likely that these numbers are even higher now. But the nature of data and research and analysis means that we take a couple of years to be able to publish, confirm, and clarify that. So we're looking at least 40%, and probably more than 40% of the population could do something to be a little bit happier, healthier, and mentally fitter. In terms of workplaces, what we see is that this costs 53 to 56 billion pounds a year to organizations alone. And that's the cost of presenteeism, which is people turning up but unable to do their work, and also absenteeism and retention and turnover. The ripple effect is also that it starts to impact client relationships and client reputation with clients. So it does have a further ripple effect. And that's why this should be top of every business's priority list all the time, not just because morally it is the right thing to do and socially it is their obligation, really, if we think about their commitment to support society, but purely from a financial perspective. Sometimes what we realize is that stress is a good thing. You know, some stress is not a bad thing. It can be good. We should feel stress when we are feeling under pressure of a certain nature. And stress can be good and it can be less helpful. But really, it's about understanding that concept. And finally, we also need to understand that being mentally fit is not about always being happy. It's not about always being top of the day, always motivated. It's about having a healthy level of fluctuation. If you do start to notice that someone's struggling with their mental health in any way, you can be really, really attuned and help them. So the things that we could be looking out for are really some of those stress signatures. Maybe changes in the way that people are behaving, in their emotions. People often become stubborn, don't want to cooperate, they become distracted. Sometimes people overwork, sometimes people underwork. Sometimes people become over-attentive, checking things and needing reassurance. Sometimes people become quite blasé and don't care. There's no fixed sign that we can look for, but what we can look for is changes in people's behaviors. If we notice this, we can then take the step to approach someone and start a conversation. And the key with that is don't overcomplicate it. I've got a really simple 3-step process for this, which I'm going to share with you now. And it's about being a mental health ally. And the first step is quite simply approach. Start a conversation with someone. We have to think about the time and the place. So probably not in a public space in work, like not in the kitchen. Take someone out for a walk, take someone out for a coffee, walk back to the station with them, walk back to the car park with them. But start a conversation. If you're doing this remotely, sometimes it can be quite hard for people to do a video call. So you might want to start with a phone call or a little message, a Teams message, a Chime message, whatever format you use. But just, hey, wanted to see how you're doing. Haven't chatted in a while. We just need to start a conversation, which is essentially saying, how are you? But the difficulty is if you say, how are you? Most people will just say, fine, not bad, or okay. So if you do go with how are you, you'll probably need to ask again and maybe just change that sort of phrase a little bit. How are you feeling? What's going on for you? How much have you been going into the office? How's that been feeling for you? Just anything you can to start a conversation where they actually give you a little bit more. I often use how are you feeling on a scale of 1 to 10. And then when someone gives me the rating, I can say, oh, well, what's making you a 6 today? And that opens up the next level of conversation. But if you try that, what you'll see is that most people, they'll give you a justification for why they're a 4, 5, 6, 8, 9. They'll give it to you anyway. And once you've got that nugget of information, you just carry on. Oh, so why is that important? If someone says, oh, I'm a 6, I haven't slept very well for a few days. Oh, is that something that's normal for you? Oh, is there anything that's going on for you? Do you want to chat about that? You just use it as a gateway. But you need to always think, have I got time for this conversation? Have they got time for this conversation? Is this the place for the conversation? And if not, how can I create the right time and place? Another top tip when you're having this conversation is for most people, it's much more comfortable to be next to someone when you're having this rather than face to face. So even if you go for a walk and you sit down and have coffee or a lunch, you can sit down at 90 degrees, generally feels a bit more casual and a little bit less like an interrogation. So just a simple tip. And it's also why sitting or standing next to someone, walking next to someone can make that conversation just a little bit easier. Once you've started this conversation, you hopefully will get to the stage of being able to listen to what they say. Listening, not fixing, not judging, not telling them they don't need to worry about that. Or, oh, but you should be grateful, you've got this. None of the above are useful. Telling someone not to worry does not stop them worrying. It usually makes them just a bit embarrassed and feel like they wish they'd never said to you that they're worrying. Because you're not helping, you're just saying, don't worry. Well, that's nice for you to say. Equally, saying to someone, oh, but at least you've got a job. If someone's feeling rubbish, yeah, and now I just feel a bit guilty for the fact that I feel rubbish. So really, really not helpful to try and tell someone they shouldn't feel that way. What's more important is to say, thanks for telling me. Please carry on. Gosh, I can see that's really hard for you. How long's that been going on for you? Just try and understand their window to the world. That's the key here. We're trying to understand how they see the world. Why is this important to them? Why is this challenging for them? It's not about your view of what you think should or should be done or should or shouldn't happen. It's about saying, I can see that this is difficult. And this is about having empathy. And to have empathy, you don't have to have been through the same situation. What you need to do is recognize and feel the emotions they're feeling with them. It's about that sense of knowing that we all go through ups and downs. And any one of us could be in a difficult position at any time. And knowing it's normal and helping that person to feel it's okay to feel how they're feeling. And there's things that can be done to help. And it might take a few conversations for you to get to that stage where someone's really willing to open up. In fact, the data indicates that it'll probably take at least 2 to 3 conversations where someone goes, no, I'm fine. No, I'm fine. Or, oh, it'll be okay after that deadline. But eventually, given the right conditions, the right person, the right place, people want to talk. It might be that you're not the person, and maybe that's the challenge. And sometimes it's important, if someone doesn't want to talk, to just say, look, you might not want to talk to me, but here are the people you could reach out to, and give them some of the people in your company, in your business, externally, charities, helplines. But don't just do once, and when someone says they feel fine, let it go. Persevere. Just keep giving that nudge, keep showing you're watching, keep showing you're caring. And eventually, once you've built that relationship and you've done some really good listening, you can move on to inform them of the different support that's available. And you can give them the hope and the reminder that recovery is not just possible, it's probable. And if you've done a really good job of listening, not fixing, of not saying, I know just how you feel, because we never know just how someone feels, but instead saying, I can see that's really hard. Thank you for telling me and being honest. Thanks for being so open about how you feel. I really appreciate it. I'm really glad you've given me that. Showing you've listened, showing you've understood, even repeating back the words they've said to check you've understood, to check that you're seeing the world through their eyes and not through your own filter. That in itself is so powerful and will mean that by the time you move to the final one and say, what do you think might help you now? They'll be much more likely to have ideas and to take action. But you'll notice in the way I say that it's not about saying, how can I help you? Because you're not the savior, and you're not there to be the savior. You're there to help them have confidence in themselves again, to take the action that they need to go and improve their own mental fitness. And sometimes there might be a layer behind that of how you can support them to do that for themselves. But we don't want them to rely on you. We want them to re-engage with their own strength, with their own potential. So asking, what do you think would help you now? And even if someone says, I don't know, I've tried everything, rather than jumping in, you can say, well, what have you tried? Have there been any things you haven't tried? Have there any ideas that you haven't given a go yet? Or if they say, well, what would you do? Rather than jumping in and fix, you can say, well, I'm not the expert in your life, but I could see some ideas, so maybe we could have a brainstorm together. And you could go through a bit of a brainstorm with them about what's available in their business or outside. And I always like to pocket that brainstorm into these 3 clusters of personal actions that we can take, internal business and organizational support, and external support. But the key is you're not there to fix, you're there to listen. And if you just take one thing from today, just take away that listen, because that is the power. We're going to wrap up today's session, but I just want to touch on one final point, and that is about the idea of boundaries. And when you're supporting someone, the key is that you need to make sure you're looking after yourself. Try and avoid saying, oh, you can call me anytime, because you might start getting the 4 a.m. phone calls on a Sunday night, Sunday morning. You might start getting people coming to you all the time. And that's fine if that's fine for you. But realistically, over time, that's going to start to probably have an impact on your mental health and your quality of life. and you're not going to be able to give them the real good support that they need. So giving boundaries around times of day or ways of messaging you is a really, really good idea from the outset. It's also useful to book in times of when you're going to speak to them in advance. So, oh, could we speak, let's speak next week at 5. So you do a follow-up check-in rather than just leaving things hanging. And it'll mean that they're more likely to take action, but they're also less likely to come and ask you lots of questions in the meantime. So give them that sense of certainty. And if you don't know how to support them, and you don't know what to do, or you're reaching out to someone and they're not taking any initiative themselves, they're not doing anything, then you can reach out to your HR team or your mental health first aiders or to your employee assistance program, and you can ask for help. Because there is support there, and it's not all your responsibility to support others. I do think it's all of our responsibility to keep an eye out and to just be aware, but we're not therapists. And we're not magicians. We can't make everybody feel wonderful all of the time. We're going to wrap up today with just a final invitation, a reminder of everything that we've learned, but an invitation for you to take something away. So I'm going to invite you one final time to pause the video and write down one thing that you will start doing, one thing that you will stop doing, and one thing that you will keep doing after today. So one thing you'll start doing, one thing you'll stop doing, and one thing you'll keep doing. And that can be for you personally, could be in how you support others, absolutely up to you. But mental fitness is just like physical fitness. You don't get physically fit by buying the trainers and thinking about the gym. You feel physically fit and you get fit by putting on the trainers and getting off your sofa. And that's the same for mental fitness. You don't just watch a video and get mentally fitter. You have to get out there and do something. And you can't just do it once. You need to keep repeating it. So I'm also going to encourage you to put a reminder in your diary for a week's time to go back to your notes about today and say, have I done it? What can I do now? And maybe that becomes a repeat in your diary, just 5 minutes once a week. What am I doing to look after my mental fitness? What am I doing to be that positive influence and to spread that ripple of mental fitness around the world? Thank you so much for your time and your attention. If you've got any questions, please feel free to email me. It's charlotte@charlottewiseman.com. You can follow us on LinkedIn, on Instagram, and please do be in touch. This is such an important message, not just because it's Mental Health Awareness Week between the 15th and the 19th of May, but it's always an important message. Every day for the rest of our lives. Thank you so much, and I hope you have a wonderful afternoon.